we're gonna start another important topic, which is Dyskeratosis congenita. Let's start. Bismillahirrahmanirrahim. Okay, so the other name of this disease is the Cole-Engman syndrome or Cole-Engman syndrome. It is inherited X-linked recessive trait. Before the two diseases we study was also congenital, but it is autosomal dominant disease, and it is more common in male. Means male predilection is more. Okay, then before I want to tell you in a story type that there was a gene. In that gene, the mutation has occurred. Okay, that mutation has affected an enzyme. That enzyme was actually responsible for the longevity of the cells. Now that gene in which the mutation has occurred was DKC1 gene. Okay, means Dyskeratosis congenita 1 gene has a mutation, and that mutation actually affect or disrupt an enzyme which was known as telomerase enzyme. That enzyme was actually responsible for critical or determining the normal cellular longevity of cells. Okay, now the oral lesions undergo malignant transformation. The patients are more susceptible to the aplastic anemia. Okay, it appears in the first 10 years of life, means in early life it occurs. In skin there are basically uh, you have a reticular pattern of hyperpigmentation. Means in reticular form there is a hyperpigmentation develops. Okay, reticular pattern skin hyperpigmentation develops on the face, necks and upper chest. Dysplastic changes of nails. So first there is an basically a reticular pattern of skin hyperpigmentation develops. Then there are the dysplastic changes of nails, tongue and buccal mucosa is involved in oral. Bulla first developed. The bulla erode, and that erode eventually becomes leukoplakia. Okay, so the bulla develops, then there was erosion, and then there was leukoplakic lesion, leukoplakia. Okay, then this lesion we know it is a pre-malignant lesion. For 10 to 30 years it is present. Then it rapidly progresses to the periodontal disease. Another new. First we have studied that there is a reticular pattern of hyperpigmentation, dysplastic changes of the nails. There is the bulla formation also. Then there is also periodontal diseases. Okay, and it has also aplastic anemia. Then there is the thrombocytopenia, which is the first hematological problem that develops during the second decade, followed by anemia, which is aplastic anemia, present in 70% of patients. You can see here the nails are involved, the legs are involved. Okay, tongue, chest, these all are involved. Neck, hyperpigmentation is present on the neck region. The tongue is involved, leukoplakia is present. Okay, and the tongue is also showing glossitis, reddish in color. Hyperorthokeratosis means there is no nucleus in the superficial layer. Epithelium atrophy means due to which there is redness or erythema. Okay, the lesion progresses to epithelium dysplasia and develops until squamous cell carcinoma evolves. Okay, so means the lesion progresses to the epithelium dysplasia and then there is a squamous cell carcinoma evolved. Okay, then symptomatic treatment for oral lesions is discomfort, careful periodic oral mucosal examination for malignant transformation. Means if there was symptoms, so you have to treat that actually, but there will be actually discomfort, and you have to do a careful examination for the malignant for malignant transformation. Now in routine medical evolution to check that also for aplastic anemia, also diagnose or allogeneic bone marrow transplantation. if it can be happen. Okay, so with this we have come to the end of this. So we have studied the reticular pattern of hyperpigmentation. There were dysplastic changes of nails, aplastic anemia, thrombocytopenia, which appears the first 70% patient suffers from the aplastic anemia. Bulla formation is also present, okay, and then leukoplegia is present, and periodontal diseases are also present.